and welcome to a Facebook Live session from Bloom Life Hospital. Thank you for joining us on this Saturday evening. I have with me this evening Dr. Kavitha Gautham. Welcome, Dr. Kavitha Gautham. And thank you for joining us this evening. I understand that you had a last-minute travel plan that popped up, and really nice of you to join us despite your last-minute changes. Thank you for coming on today. I'm going to lead into this session with a little bit of a background, because this, I feel, is a very important topic and something that everybody has been talking about in recent times. So there is a kind of a common perception that if a woman who is pregnant goes to a hospital to have her delivery, the hospital and the doctors may actually kind of gently push her, or even kind of keep pushing the option more of C-section than of other options, especially normal or natural deliveries. This perception, in fact, more importantly, because of this perception, a lot of people have started to explore the option of giving birth at home with the assistance of midwives or doulas. And they're saying that it's kind of like the same thing and we can do it at home, so why not? So in this Facebook Live session, I want to explore two big topics. One is, why are C-sections on the rise in recent times? And is this a reason to justify the perception that hospitals are pushing this trend? And the second part of it is, are home births a truly safe option for mothers? So I'm going to start, Dr. Kavitha, by asking you a very straightforward question. As a healthcare professional, as a doctor who's been in this line for about more than 2 decades now, you must have seen this rise in a trend that if a woman goes to a hospital for delivery, there is an automatic push from the hospital side to say, why don't you go for a C-section? What is the reason this perception even came about? And as a doctor, what are your thoughts on the ground reality?
Okay, so I hope I'm audible, Yamini. Okay. Sorry, I'm taking this live session from the car because I'm traveling. Yes, everybody has this idea that doctors are pushing patients for more C-section without no reason, and delivery has become a money-making business. All that is definitely there. There are so much of newspaper articles which are saying that, and then there are nowadays we are even seeing movies talking about it. So one thing I would like to inform everyone is that it is not a doctor's choice to do C-section. It is the country's choice to make sure that the maternal mortality rate is less. For any, WHO came with the concept of any developed country should have a maternal mortality rate of one particular amount. So if you say you're a developing country or a developed country, you should have a reduced mortality rate. So this is very important. And in that sense, recently, that is last month, our India's maternal mortality rate was declared for the year of 2018-19. I think it was a calculation for 3 years. And from which was 130, the previous statistics, it has come down to 113. It is a good achievement by the country. So this is a happy news that we are reducing the maternal mortality rate. How does India come to this point of reducing the maternal mortality rate is because our healthcare system is closely monitoring the delivery process. So if there is any complication during delivery, it is not just that hospital or that doctor who is responsible for that complication. It is going to the district level, it is going to the state level. So immediately it is sent to the collector's inquiry, then it is going to the state's inquiry, and then only it is closed. So every small difficulties faced during labor is not just the independent doctor's responsibility. It is taken as an entire state, entire country's responsibility. In that sense, that particular doctor is in a very high responsible state, especially the gynecologists or the obstetricians. So they're very scared to face any complication because they are called upon for inquiries to the state level. So this is something which is making the doctors being more careful with each patient they see. So even if there is a slightest chance of risk, the doctors don't want to take that risk. The final priority is even the theme of our Tamil Nadu government is safe mother and child. So this is the priority. So in that, what we've achieved is we've achieved a reduction in mortality. That is, death rate of the mothers have come down, but the comfort rate of the mothers have also come down. So we're not giving the comfort for the mother. We're not giving the emotional support. We're not listening to them. So sometimes the problem is the doctors don't explain to the patient why they are having the issue, or they don't explain to the patient why the C-section is being done. So this, I think that is a problem with communication rather than any other thing. This is one important point I would like to talk about. The second is, when we talk about technology in all aspects, like we don't walk nowadays, we're using a car for any small distance, we take an auto, or we take a two-wheeler to walk, two-wheeler to drive. And the kind of work we do at home also, we have a grinder, we have a mixie. When the woman is pregnant, immediately the maids are hired in, make sure that the woman is comfortable, and even the relatives make sure that the woman eats well and rests well. So this is something which is being more given importance to out of love and affection and care. So what happens eventually, because our technological development and more number of care given by our surrounding people, the woman is just allowed to eat and sleep and during the entire pregnancy period, end up having double birthing, because they end up having a lot of complications like diabetes, hypertension. There's lack of physical activity leading to there is a lot of, the labor doesn't start early, or the labor process doesn't go at all. Most of the time, they end up having a postdatism. So all this is because the woman doesn't have any physical activity at all. They themselves are putting them into some kind of complication, and finally, they end up blaming the doctor. So this is something I would like all the pregnant women to understand. Their lifestyle is directly proportional to the outcome of the pregnancy. So if you are having a very good diet, you're maintaining your weight and through the pregnancy, that is, your weight is equally proportional to the baby's weight. So if you don't gain weight, the baby is not going to gain weight. If the baby is going to be small, eventually you will have a comfortable delivery. And the other important thing is the physical activity. You should be physically active, whether you're doing a household chores and keeping yourself active, or whether you're doing some yoga, doing some exercise classes, being a part of some workout groups. Anything could be effective.
You did bring up two very important points. One of them, which you talked about, which is the comfort factor and the communication with the patient from the doctor. I will come to it at a later point in this Facebook Live. But what is very important in your explanation was that the doctors are in a really responsible position for the mother and the baby. So the decision to take a C-section is not something that they do because they want to, but because they are responsible for the good health and well-being. And that is actually a reassuring thing to know that such great care is taken when they approach this issue. Now, I do want to ask you, doctor, so when we talk about why the decision is taken for a C-section, what are some key reasons that the doctor might face which tells them that this is the right way to go? And more importantly, can we know about this need to have a C-section early on in the pregnancy, or is it something that comes only when the lady is admitted for her delivery itself to the hospital?
Okay. I think the C-section decision comes mostly when the woman is closer to the delivery time, because earlier to that, maybe if they have some medical complications like renal failure, or a renal condition problem, or diabetes or hypertension, which will give us an idea, okay, this woman is not under control with medication. Probably we might have to deliver early. Some medical conditions which can give us a clue of doing a C-section. The other, most of the times it's during the labor that even the doctor will come to know, like whether she's getting into labor is one thing. If she's not getting pain beyond her due date, definitely there's the chances of getting into C-section is more. And if the woman is getting into labor, but then the delivery process is very prolonged, again there is a chance. And if the baby is getting into fetal distress, this is the most commonest cause I feel nowadays, when baby has some kind of distress. So again, you will end up having a C-section. And there are certain other complications like CPD and pelvic arrest, so many other obstetric complications which can lead to. All this is mostly seen during the labor time or at the end, the last few weeks of pregnancy.
Now, I know that as a gynecologist and a fertility expert, you personally are a big proponent of normal and natural birthing. You have talked about it in many forums. You've spoken about it in depth in many places about how a natural or normal delivery is the preferred option when it comes to birthing. So when we talk about these options, a normal or natural delivery or a C-section, we have looked at the idea of how a hospital is not driving the decision to have a C-section. Neither is the doctor. It is something that happens because of risk factors that need to be looked at and immediately addressed. But when we talk about this, this continued perception, there has also been a new trend of home birthing. People have been saying that, okay, if I have this option, I might as well give birth at home, because they automatically associate a home birth with a natural birth. Now, my question is the location, like being at home or being in a hospital, does it make a difference to the birthing process itself? And more importantly, to the good health of the mother and baby?
Okay, so home birth is something which everybody wants. First, let me say why people want home birth is because they want the comfort zone. They want the lovable people around them. They don't want an unrecognized environment around them during the major stress period for them. They want people around them, the comfort, especially for the emotional comfort. So this is acceptable, but but also home birthing was the only thing which was happening like a few years ago, like 70, 80 years ago. I think most parents and the grandparents' parents, all they would have gone through a home birthing. But why the home birthing was stopped is because there were a lot of deaths which were also happening during the home birthing. We were all only considering, when we talk about, we are only taking the positive aspects of anything and everything, but we don't consider the negative aspects. Even if it was one death around 100 women who are laboring that particular point of time, even that one death has to be given important by the government. It should be prevented. It is a preventable death, definitely. If the woman had had an emergency support, if the women had been in the hospital for a blood transfusion, blood availability, I think those things could have been avoided. So in that sense, government started, banishing the home birthing system completely. There were guys who were supporting the home birthing initially. The guy system completely stopped, and it was I think the shift happened during 1960s, where hospitalized birthing was promoted for the safety of the mother. And what happens during a home birthing is, if the birth happens comfortably, that is fine. But if there is some kind of problem, like suddenly your labor is not progressing as expected, the labor is prolonged, or sometimes you don't know the position of the baby. Sometimes the head will come out and the baby's shoulder might not come out. These are nightmarish kind of situations even we have been through during our study period. So if those kind of things happen during your home birthing thing, what will happen at home? It is going to be a life of your of the mother and the baby who's yet to be born. So putting them into such a huge risk is something which has to be avoided. And the other thing which we have even seen in Tamil Nadu's home birthing thing recently is, I think one of the women who delivered had a continuous bleeding after the childbirth. The placenta didn't come out at all. And the husband, after that, he rushed to the hospital to remove the placenta and save the wife. By the time he reached the hospital, wife was completely unconscious and declared dead. So these kind of things are happening. Only thing is we don't take it as an example. We only take the right things and rosy things as an example. But in India, again, the other thing is how good our hygiene system at our house is. We don't. So there should not be any neonatal infection which is being passed to the baby. That is also very important. So the most common nightmarish thing is the postpartum hemorrhage, where after delivery, the woman can have a chance to bleed more and bleed to death as well. So these things, though it is not very common, if it is going to happen in a hospital setup, I think we can handle it. If it is going to happen in a home birthing system, definitely the life of the mother and the baby is at stake.
I think those are some very important points that you brought up, especially the postpartum issues that arise and the question of infections that can kind of take place in the process itself. I go back to what you said about people seeing the rosy side of things and not looking at the big picture. And one of the things they always talk about is they say, if I'm in my own home, I have a lot of space to walk around. I have my freedom to eat and drink through the labor process. I take it at my own pace. Whereas in a hospital, it's very regimented and it's very difficult for me to feel emotionally secure. What are your thoughts on this, Doctor?
Definitely, the comfort zone, of being at home cannot be reproduced in a hospital environment. But nowadays, we are also doctors are also able to understand the requirement of the wishes of the mother, and we are trying to give as much as a homely care at the hospital. That is why a natural birthing, which is happening in the home hospital-based setup, is something which is more comfortable and more acceptable thing medically as well. So I think there should be a system where both hospital-based and the comfort, whatever the mother needs, should be, if it is going to be provided in the hospital, that will be the best kind of system which could give both the doctors and the patient what they want.
I think that would be more like a best of both worlds situation for everyone concerned. I do want to bring in this thought. I know that you have been a proponent of bringing the husbands in to support the wives during the delivery process. You do encourage the husbands to be part of this entire thing. Can you tell us a bit more about that?
So in a Western culture, I've always seen that the husbands were always allowed inside the delivery room. But in Indian setup, the doctors are against it. But I felt allowing the husband can give us a little more emotional support to the woman. And the second thing which I'm seeing is a bonding between the husband and wife after the childbirth. No, it's a very memorable occasion in their life, and it is being cherished by most of them. Like that moment, if we can capture, I think that would have been the best moment in their life. Like holding the baby for the first time, and the feel of achievement that you have done something great together. And it's amazing that to see them as a couple. So this is a very important thing for their future as well. As a couple, no, they should understand each other. They should be seeing what the wife is going to get that baby out. And the third thing which I feel is nowadays, the husband is becoming a witness for us. no, so blindly, if we say, no, the relatives are all kept outside, and finally we come out and say, your wife had so much complication. We waited for so many times, so many hours, and she's not progressing. She's just not bearing with the pain, and we are taking her up for a C-section. It's a one-sided thing. Doctors are definitely monitoring, and we are only giving our one-side version. Everybody is seeing that the woman has got difficulty from the family side. So now I have a witness inside the labor room who's seeing everything, and finally the husband is the one who's making a choice of to wait or to make an early decision or anything. He's there with us to make a conscious decision. So most of the times they become our cheerleaders, they become our witness during the labor process.
I think that's a lovely term you use, the cheerleader, and that's I think the best way to put it. And I think the most important thing is when the woman has her husband right there with her, there is a sense of comfort, there is a sense of being at, not home, but at least being at home in some sense of the word. So this is really a commendable move. I also have seen pictures of some husbands actually fainting and falling down on the floor because they didn't understand that a birth can be such a immense physical and emotional process that their wife goes through. Wonderful, wonderful, doctor. We did talk about this idea where you said our lives have changed. We do use a lot of gadgets, which our grandmothers did not use. We have a lot of transportation options. We have digital for everything that we have in our lives. So of course, we cannot say that I want to do like my grandmother did. But you did talk about it in brief, saying do be active and keep a healthy lifestyle. Could you give us a little bit more detail to say when a woman decides to have a baby, even the planning stages itself, what are some important measures she can take to make sure that her health, and I'm talking about physical and mental, can be in line and well to support a good birth?
Okay, so if you want a comfortable normal delivery or a natural birthing, the first thing I would like to reiterate or tell everybody is that the comfort is at the woman's hand. It's not with the doctor. So if you are very careful even during the pregnancy time, I mean, most of the time what we say in Tamil is ஆசைப்பட்டதெல்லாம் சாப்பிடலாம். Pregnancy is a time where you eat whatever you want. And also you should eat for two people. ரெண்டு பேருக்கு சேர்த்து சாப்பிடணும். These are all very common words and sentences which we hear from the families. So this is a myth. Actually, pregnancy period is a period where you have to be even more careful with your diet. You should concentrate more on your healthier side of the diet, like more of fruits and vegetables, reduce your fried items, reduce your carbs, reduce your unwanted sugars, and this is very important. And this is something which I talk from day one of my consultation and keep on asking them during each visit, and we make sure that we keep a monitor on the weight. There are women who come and meet me with 7 kg weight gain in 1 month. So imagine if she's going to gain 7 kg in each month, she's going to cross 20-30 kilos by the time she's going to deliver. And how do you think this woman can have a comfortable delivery? Obviously, she's going to go into hypertension. She's going to go into high sugar levels. And obviously, she's not going to do any physical activity. Keeping her in one position to deliver her, birth her in one position only is going to be difficult for the doctors and for the patient. So they have to understand that they have to be fit enough to deliver. Second is your physical activity. Even if your weight is under conscious, see there, the baby has to come through a 10 centimeter vaginal hole. That passage is only 10 centimeters. Even it is going to be lesser than 10 centimeters before the birth. So it has to expand to 10 centimeters to get that baby out. So the baby cannot walk and come out. So we have to create that passage for the baby to come out. So how do we create this passage? How do we make sure that the body is comfortable enough for the baby to come out is by doing some pelvic exercises. Either it could be yoga, it could be some pelvic stretches. The regular cardiac exercises are very important to keep your body, fit. And also it could be your household chores. Like in those days, they were doing like brooming the floor, not with a vacuum machine, brooming the floor properly. And squatting and mopping the floor is something which I tell them to do, because squatting and mopping is something called Indian squats and a combination of duck walking as well. So whether you do it as an exercise or whether you do it as a household chores. And the other thing I ask them to do is to sit on the floor. Whatever they do as an activity, sit on the floor and do. Whether you're watching TV, whether you're eating food, sit on the floor. Sitting on the floor itself will stretch the pelvic outlet. So these are simple things by which they can have a tremendous change in their pregnancy outcome. So these are simple things which we don't follow out of fear sometimes, out of myth sometimes, and then finally end up having complications and finally blaming the doctors.
I think whoever's watching today will definitely stop pointing a finger at the doctors going forward whenever it's a C-section call. I'm very confident of that. But very, very well explained, doctor. What you have brought out is two things. One is that this is not something that just happens naturally. We have to prepare our bodies for it. And we have to take the effort to move towards that. It's not like 10 months pass and then one day the baby just pops out without an effort. And more importantly, that this doesn't require some rocket science or some extremely, we have to chart out a new diet plan or we have to go to a gym or something. Many of the things you mentioned, which can be done at home, our regular chores, and which can keep us in a very healthy and fit condition. I know that there are also antenatal classes that women can join where they are guided on how to keep themselves fit and flexible. So many options, so many ways to prepare ourselves, and good amount of knowledge coming to help all these women in their pregnancy journey. This was one part of it that we explored today, and there'll be many, many more questions coming your way, Dr. Kavitha, in the coming days. But for now, we will wrap up this Facebook Live session. Thank you so much for joining us, even though, like I said, you were on travel, on a sudden travel plan. And thank you to everyone who has joined us this evening. We hope you had a informative and engaging session. And we look forward to seeing you at our next Facebook Live session. Thank you. Good evening.
Thank you so much, Yamini.
Thank you.